Which new health crisis is India up against now? What has Lancet's shocking report revealed for us?
Hyderabad's AIG hospitals and published in the Lancet warns that 83% of Indians walking into hospitals are already carrying drug-resistant bacteria, the highest among all countries surveyed.
Superbug crisis post-antibiotic times. What is it and what can be done? India is standing on an edge of a medical disaster. A Lancet study recently has shown that 83% of Indian patients are carrying a superbug. That means the medicines that will be given to them for infections will not help them at all because they have AMR. Now, when we are talking about this situation, this is not just a health crisis. It is so big, as highlighted by the report, that it is a national security threat as of now. Hello everyone, welcome to Vajram and Ravi's Flash News. My name is Shubhangi Singh and today we will be understanding not just this highlights of the Lancet study report, but also understand that what exactly is AMR, what exactly is a superbug, and what crisis we are talking about. So before I delve into the details and highlight the details that have been pointed out in this Lancet study, let us start with understanding the concept of AMR, that is antimicrobial resistance. So when we talk about AMR, as the name itself gives away the definition, it is nothing but a situation when basically the microorganisms evolve in such a manner that they are able to resist or they are immune to the medicines which are used to kill them. So for example, if there was this medicine X which used to treat this particular microorganism, they have got so much used to it, they have developed their immune to it, they are responsive to it in such a way that this medicine is no longer effective to kill them. There are multiple reasons why AMR might develop. For example, there can be a natural mutation which exists. There can also be a reason of overuse and misuse of antibiotics, sometimes poor sanitation, poor hygiene, and another important factor here is hospital-acquired infections. Now, when we are talking about antimicrobial resistance, we have understood what exactly this means. Let us also look into why it is dangerous. AMR becomes dangerous because once it has set in the foot, the basic infections, they also become untreatable. For example, if you are having cough and cold and you take antibiotics, let's just imagine the antibiotics that give you relief, they stop working. So all such minor routine infections will become untreatable, and the complex procedures such as surgeries, cancer therapies, chemotherapies, C-sections, all of them will become risky because the antibiotics that we are taking, they might not work at all. So this, I hope, sounds like a more than just a health crisis. Now that we are discussing AMR, the dangers, let us also understand that how it spreads. So when we are talking about antimicrobial resistance, the spread is especially through the food chain. Let's just say we have antimicrobials or antibiotics that we use. You will find these antibiotics, antimicrobials are given to food producing animals, these antibiotics are given to the patients, and then the cycle sets in. The food producing animals, that bacteria develops in the animals, then the drug resistant bacteria spreads to the environment, people around it, and it enters the food. And then it is transferred to people who are eating food, and then they fall sick, then they are treated with antimicrobials again, and it enhances the resistance more. So I hope I have displayed and made you understood that what AMR looks like and how dangerous it can be. Now let us understand that what has been highlighted in the Lancet study that we are talking about. When we talk about this study which has been published in the Lancet's eClinical Medicine, it had a whole research paper, the whole study, which highlighted and it studied 1200 plus patients across 4 countries, including India. It also had Italy, Netherlands and United States. And the whole idea of this study was to understand the prevalence of multi-drug resistant organisms that exist. And as the result of this study, we find that there are prevalence of superbugs. So basically, superbug is nothing but a strain of bacteria which has become resistant to antibiotics. Now, when we talk about the prevalence of this strain of bacteria in patients, in India it has been found to be more than 83%, and at present this is highest globally. In Italy it was 31%, United States 20%, Netherlands 10%. That means India remains at the center of the crisis where we are trying to deal with drug resistance bacteria. So India, where we have other health crises, be it hypertension, be it obesity, we have another one in front of us to deal with. And furthermore, other details that have been highlighted in the report which will actually explain the depth of this situation, the seriousness of this time, is the fact that almost 70.2% is ESBL producing bacteria which has left common antibiotics ineffective. Then there is 23.5% Carbapenem resistant bacteria in which last line drugs, that means end use drugs, they are already failing, they are not working. And there are many patients in that 83% number which do not have just one superbug, they have multiple superbugs. Now in this situation, the only analysis that has come out that the spread of this superbug is not at a local level or the hospital level, it has gone at the community level and it should be contained at this level. Otherwise, the serious repercussions that we talked about in terms of AMR at the start, we are looking at that immediately. It can happen with our country, the healthcare system immediately. The healthcare system might go defunct because the treatability of the basic procedures will not exist and the complex procedures will become too risky for lives to be taken. Now, we have understood the main highlights of the Lancet report that have come out. Now, let us move ahead and understand that why is India's AMR so high? Why the antimicrobial resistance in India specifically is at such a huge difference, where you are seeing Netherlands at 10%, let's not compare with Netherlands, even if we are comparing it with Italy where we saw it to be 30%, we are more than double. Why? So, there are multiple reasons associated with it. The first one being is the human factor. So, when we talk about human factor, let me remind you of usual scenario in India. Whenever you have a cough or cold, our preference is not to go see the doctor. We go directly to the druggist or the chemist and we ask for the medicines. So, we direct have the access of antibiotics over the counter. It is the chemist who can provide it to you. So, that is why we see self-medications, there are fake doctors, and even if we are going through hospitals, there are multiple scenarios which have reported over prescription in the hospital. If we are not going with the proper dosage, we are facilitating AMR automatically. It is just something like when you keep introducing that medicine in your body, as simple as that, you keep introducing into your body, the bacteria or the microorganisms get used to it. So, this is the situation where we find in the human factors. Other than that, we have also the environmental factors such as there are multiple pharmaceutical waste which are disposed in rivers. Now, these rivers are, the water from these rivers are processed and they come to your food chain. Hospital waste, which is another point of infection, that is mostly untreated, and then the antibiotic misuse that we get to see, especially in food producing animals, be it poultry or livestock. This is not it. We have another important dimension to cover, that is the healthcare system itself. So, there are issues with the healthcare system which are responsible for such an high AMR in India. For example, there is very limited and weak infection control. If we talk about the antibiotic stewardship programs, they are non-existent as of now in India. And we have high infectious disease burden. That means infectious diseases that can spread from one person to other, their numbers are high in India, and with the spread of the disease, we are also getting the spread of AMRs and superbugs. This is the situation, but the question here is, when we have such high AMR, what kind of consequences we are looking at? We are looking at multiple consequences in terms of health, in terms of economic numbers and others. When we talk about health, as I already highlighted, the basic routine issues, infections will become untreatable, medical procedures, complex procedures will become risky, increased, and because of this, you will find increased mortality or prolonged illness, and both of these will lead to decreased production and human productivity in our country, which is going to affect the GDP and further scenarios. If you talk about the economic consequences, apart from direct impact on the national income, there will be extended hospital stays, which is going to cost your pocket. There will be increased cost of last resort drugs, because the basic drugs are not working, the higher line drugs would be facilitated, and because the demand will go up, supply would be limited, the price will skyrocket. Other than that, productivity losses, as I just mentioned, will happen. We'll also get to see, apart from just the health consequences and economic consequences, there will be an impact at national and global level in terms of consequences. And when we are talking about consequences, as I highlighted in the start itself, we are talking not just about a health crisis. This should be seen as a security threat, which could make so many cuts across the nation that it would bleed really heavily. So in this situation, this will create a scenario where the travel and medical tourism will become difficult, and we know India's foreign reserves get major input from tourism as well as medical tourism, and as of now AMR is recognized as a non-traditional security threat. That is very important, because if not, this is not addressed, it is going to undermine our sustainable development goals, be it SDG 3, 6, 12 or 15. Can you tell me in the comment section what is Sustainable Development Goal 3, 6, 12 and 15. Now that we have laid down that there are going to be worse consequences, we need to understand that what is the present scenario in terms of addressing this situation in India. So if we talk about addressing this situation, yes, we have started to walk on this path, but there is a long way to go. We have already made progress because we are here with National Action Plan on AMR. It was launched in 2017 itself. We have a red line campaign, schedule H1 regulation, and there is also National AMR surveillance network. But the problem here is we have made this progress, and as I say, there is a still long way to go, because this is present, yes, but the implementation not so much. There is very limited enforcement, especially of prescription laws. There is poor hospital infection control. There is unregulated antibiotic use in livestock, and pharma pollution is still not addressed. So there are large loopholes that we are still looking at. They need to be addressed, because this AMR crisis and what has been highlighted in the Lancet study is a ringing alarm bell, and it needs to be addressed. How it can be addressed? It can be addressed through changes in regulation and governance. We have to bring in schedule H1s more strictly, ban all sorts of non-therapeutic livestock antibiotics, and focus on controlling pharma effluent discharge. Other than that, hospital infection control is most important. That will come in by mandatory antibiotic stewardship programs, routine pre-procedure screening, and definitely strengthening sanitation as well as sterilization system that exists in hospital. Other than that, awareness will also play an important factor, where public needs to know about these issues so that the human factors can be eliminated. So public campaigns, training frontline workers and pharmacists is going to be an important step, and one health approach can be a game changer here, where we bring in human, animal as well as environmental health systems together to address this AMR crisis at once. Focus also needs to go to the research and development, especially for new antibiotics and better diagnosis, so that this can be addressed without last resort drugs as well. Now on this note, I'll be leaving you with a practice question. This is the practice question for today. You can leave your answers in the comments section. And now I'll be revealing the answer for yesterday's question which was put up. The correct answer here is B. That was all for today. Thank you so much.